Gout pain, how to adjust prescription medication dosage. When it comes to managing gout pain, adjusting prescription medication dosage is crucial. This process involves careful consideration of various factors, including the specific medication, the severity of symptoms, and individual patient characteristics. The two primary medications for gout are colchicine and allopurinol, and each has its own guidelines for dosage adjustments. Colchicine is often used to treat acute gout flares and to prevent future attacks. For an acute flare, the typical starting dose is 1.2 milligrams taken orally at the first sign of pain. After 1 hour, a follow-up dose of 0.6 milligrams can be taken, with a maximum of 1.8 milligrams within that hour. If a patient has kidney or liver issues, or is taking certain medications that interact with colchicine, the dosage may need to be lowered. For preventive treatment, the dose can be adjusted from 0.6 milligrams twice daily to 0.3 milligrams twice daily or 0.6 milligrams once daily. In acute situations, the initial dose may be reduced to 0.6 milligrams, followed by 0.3 milligrams an hour later, with repeat dosing not occurring sooner than every 3 days. Adjustments should be made cautiously, typically in 0.3 milligram increments, based on how well the patient tolerates the medication and its effectiveness. Allopurinol, on the other hand, is a urate-lowering therapy that helps prevent gout attacks by reducing uric acid levels in the body. It is usually started at a dose of 100 milligrams once daily. Adjustments to this medication depend heavily on kidney function, which is measured by estimated glomerular filtration rate. For patients with normal kidney function, no adjustments are needed. However, for those with reduced kidney function, the doses are progressively lowered. For an estimated glomerular filtration rate between 30 and 59 milliliters per minute, the dose is 50 milligrams once daily. For an estimated glomerular filtration rate between 15 and 29 milliliters per minute, it is 50 milligrams every other day. For an estimated glomerular filtration rate between 5 and 14 milliliters per minute, it is 50 milligrams twice weekly, and for those with an estimated glomerular filtration rate below 5 milliliters per minute, it is 50 milligrams once weekly. The maximum dose typically does not exceed 800 milligrams daily, but this is individualized, and any increases should be gradual and under medical supervision to avoid adverse effects. Key points to remember when adjusting gout medication dosages include starting at the lowest effective dose and adjusting based on how the patient responds and any side effects experienced. Regular monitoring of kidney and liver function is important, as impairments may require dose reductions to prevent toxicity. It is also essential to consider potential drug interactions, especially with colchicine, which has a narrow therapeutic window. Avoiding frequent or high-dose repeat treatments with colchicine is important to reduce the risk of neuromuscular toxicity. When increasing allopurinol doses, it should be done gradually to avoid triggering gout flares or hypersensitivity reactions. Always consult a healthcare professional before making any adjustments to medication dosages. Personalized medical advice is essential for safe and effective management of gout pain and flare-ups. Regular communication with a healthcare provider, adherence to prescribed regimens, and routine monitoring are critical components of managing gout effectively.